Hello, and welcome back for day 2 of the 2022 virtual FOP family gathering. Thank you for joining us for the session FOP and caring for the nose, jaw, and throat. Before we get started, I just wanted to make sure that everyone is aware of the Q&A button on the right side of your screen. It's important, if you have a question for our panelists today, to please submit that through the Q&A so that I'm able to see it and get it posed to our panelists. If you'd like to say hello in the chat, we would love to hear from you to see who's joining us today. So please feel free to use the chat as well. And lastly, I wanted to point out that this session is available in artificial intelligence translation in up to 25 different languages. So to access translation, please click on the Wordly button on the right side of your screen. And I am going to do a very brief introduction today because the 4 panelists you see here have met ahead of time. Unfortunately, there was a conflict with Dr. Pim Schroeder's schedule. He's unable to join us live today. So the group met prior to today's session to film an introduction and a very brief synopsis of how they work together as a team. So we're going to watch a film of their introduction and then have a live Q&A dynamic discussion. And before we get to that, I just wanted to say that I am so grateful to the team from the Netherlands for joining us here today. I know that a lot of families in our community have questions about jaw mobility or about swallowing, that the jaw and the throat are definitely affected by FOP, and the ability to just consume your nutrients and make sure that you're keeping up an adequate diet can impact so many other aspects of life. So I know this is a really important session. And here in the US, our families are spread out all over the country. And unfortunately, there's not any one team of ear, nose, throat, or specialist in these areas who treat a large number of FOP patients who are available to do this session. So I'm very grateful to the team from the Netherlands who's able to work together closely to see all of the families in their country and provide that support, and that they're willing to join us today to share their insights. So with that, we'll hear a brief introductions from Dr. Marilies Eekhoff, Dr. Marilyn Gilimsey, Dr. Tadej Goedere, and Dr. Pim Schroeder from the Netherlands.
Okay, thank you very much for this invitation. I would like you to introduce you to a very important part of the large Dutch clinical FOP team, the specialists who deal with head and throat problems. They will each tell of them what their specialism entails. Then we will show you how we work together. I hereby give the floor to Marjolein Gilliamsen. Marjolein.
Yes, hi. Welcome everybody. My name is Marjolein Gilliamsen. I'm a maxillofacial surgeon at Amsterdam UMC. And I mainly work with children, like cleft patients, but in my work, I also see children with rare bone diseases, and that's why I'm also part of the bone team that Marilies founded. And every time that she needs me for an FOP patient, she contacts me, and then I can do a consultation. And we have quite a lot of FOP patients in our bone team. So I think we all see a lot of them and see a lot of their problems very often. And I would like to give the word to Tadej Goedere. He is our, well, he will introduce himself, of course.
Hello, my name is Tadej Goedere. I'm an ear, nose and throat surgeon, and I'm specialized in ear surgery. So through Marilies, I got involved in the rare bone disease group. For other bone diseases, I see a lot of people who develop their hearing loss. And from the ENT perspective, if I see people with FOP, I first try to treat them myself, but otherwise I consult my colleagues. So, for example, if I have a patient with swallowing issues, I contact one of our laryngologists, we discuss FOP, I contact one of our speech therapists, and we can do a barium swallow. It's a is a dynamic X-ray of the swallowing function, and we can assess where the swallowing problem is and try to advise them how to have a better and safer swallow. Now I would like to give the word to Pim Schreuder.
Thank you today for giving me the word. My name is Pim Schreuder. I'm a maxillofacial head and neck surgeon. I mostly work with oncology patients, and I perform the ablative and the reconstructive surgery on those patients. And through those patients, I gained the experience with the swallowing problems that those patients get after the surgeries they get and the other treatments. Another specific research interest is bone pathology, where we look with our research mostly at how can we better diagnose different bone tumors, and how can we find any targets for systemic, like medical treatments for those patients. And that's how I got into touch with Marlies, and how I also got on board of the Amsterdam University Medical Hospital Bone Tumor Group.
Thank you all for this good introduction. Now we will show how we collaborate. For instance, often questions of patients first comes to me. If they have problems with eating, it can be that it can have many causes. Then we discuss this patient in our team, and now I will show you how we'll do it. First of all, I will go to Tadej. There's a patient that doesn't eat well. Can you imagine, FOP patients, what kind of investigation you could do or think of?
Yeah, so thank you, Marlies. So I would contact one of our laryngologists and a speech therapist within our team who specializes in swallowing disorders. I would perform a barium swallow and see if, together with the speech pathologist and the laryngologist, if we could think of ways to improve swallowing function.
Okay, thank you very much. And then I go to Marjolein. Marjolein, what kind of investigation on your specialism you could think of and you would like to investigate in this patient?
Yes, what we try to do is to be involved in this patient group in an early stage, because very often people eventually develop a limited movement of their jaw. So it gets very, very small, and for dentists it's really difficult to access their mouth, and that's why dental problems develop. So actually we try to prevent that by giving all our patients regular dental care with checkups and with preventive measures to make sure that by the time maybe their jaw closes up and it's difficult to treat them, that we don't need to do emergency treatment. But sometimes we also see patients from other countries or people that haven't seen a dentist for a little while, and then there can be a lot of dental problems, very difficult to reach by the normal dentist. And we also have a specialized dentist in our team, and usually we have a look at the patient together, just the dentist and me, and together with the dentist we make a treatment plan for them, and we try to really make long-term plans, so not just to take a tooth out that's hurting them, but to make a long-term plan for a more sustainable dental health. So we would do X-ray examination of the mouth and see if there's any problem in that area.
Okay, thank you very much. It's a lot you can look at. Then we come to Pim. Pim, you know a lot about bone, about the throat. What could you add? What is your idea?
So I think most of it has already been said by Tadej and Marjolein. I think the swallowing is and the eating is a really complex movement where you need to find where is exactly the problem that the patient is experiencing in processing and taking in the food. So is it more in the chewing? Is it more in the transport, or is it more in the swallowing when it's actually the complex movement of the the movements from the back of the mouth into the esophagus. So I think it's more like the combination of what Marjolein and Tadej just earlier said. It's to find exactly where is the problem that the patient is experiencing, and then try how can we actually sort of find a solution for this.
Thank you very much. So now we discussed the case, and then we make an appointment. I think it would be good that we all see the patient, or maybe we can start with one of the team. Marjolein, what do you think? Shall we both start and then call Tadej and Pim to join if we first see the patient, or the patient has to travel to Amsterdam, often from abroad?
Yeah, I think we always try. It's sometimes difficult with different schedules, but we really try to combine a visit that as many doctors that are involved can see a patient, that we can do as many examinations as we need to limit the amount of travel that patients need to do. When they live in Holland, it's still not a very big country compared to some other countries in this world. So they're all pretty close to the hospital, but still, it's a hassle to move to us and to be a whole day with all these examinations. So we really try to combine all our outpatient clinics to have a look at a patient. Not always possible, but something we would like to do.
Okay, then we are going to find a time where we all three can be there. And we will manage. Thank you very much. And now we will turn over for questions from the community.
Thank you again, Marilies and Marilyn and Tadej, for taking the time to join us today. So we are going to start our questions off sort of working from the top down. I know we had a good amount of questions that were submitted in advance, and there's some coming in live. So let's start with the ears. So Tadej, this one is going to come to you. We had questions that were wondering, does FOP bone grow in the ear? And why is there a loss of hearing associated with FOP?
Yeah, thank you. Hope that's an excellent question. Here, important to see FOP. So as referred to as an invisible disability. And
we seem to have some audio connection issues with Dr. Goodery. Can you hear us? Okay, we will start with you then, Marilyn. And maybe we'll come back to you today in a moment. But so sort of moving on down now to the jaw specifically. Do you have advice, or sort of what are the next steps for someone who is experiencing that jaw mobility? So they've had flare up or they've had bone growth in their jaw. What are the next steps you would recommend for them?
Well, the problem is that we don't really have anything that can really prevent at the moment that the jaw movement gets restricted. So my advice really would be to be proactive and to make sure that you have a very good oral health and that you visit a dentist regularly. Because when the movement is getting restricted, then it's going to be really difficult to get good dental care. So it's important to be preventive and to make sure that there's any lingering problems that can occur when you cannot move your mouth as good anymore. So that would be my first advice, to find a dentist and to really make sure that you have excellent care before any problems arise.
And even to maybe work with that dentist to make sure they're very familiar, because I know dentistry can be a sensitive area. There can be some harm that dentists can unknowingly do. So educating that dentist about what they need to know. Do you have any tips for people who maybe haven't been seeing a dentist as regularly
No,
as they could be?
No, but you're absolutely right. It's really important that the dentist does not do any harm, because we know that they can. So it's really important that the dentist is very much aware of your condition, and have them educate themselves and read all about it, and maybe contact other dentists or maxillofacial surgeons that know a little bit more about it. But that's really important, that they are aware of your condition. So first talk to the dentist and not let them do anything before they are really aware of what your condition is.
Yeah. And I know we had talked in advance about how, it's hard for patients or individuals with FOP or families to explain FOP to a dentist. So just to remind people that there are great resources on the IFOPA website. There is the International Clinical Council on FOP has written treatment guidelines, which includes a section on dentistry. And then there are several dentists around the world who advise on care for individuals with FOP. So sometimes it's a matter of connecting your dentist to one of those. And we kind of talked about, it would be wonderful, of course, if the team from the Netherlands could see everyone from around the world to be able to provide care, but that's not necessarily the most realistic result. So we really encourage you to work with, if you have an FOP medical expert in a regional or on a national level, to work with that expert and have them connect through the International Clinical Council on FOP with other experts who can then provide some of that consultation through the network that is established there, so that you're able to reach sort of the global expertise and the breadth of knowledge that's out there, but you're just doing it through a channel that doesn't overwhelm any of our doctors who sacrifice so much time. So kind of a next step recommendation on that area. And Marilyn, I'll stick with you. So if someone unfortunately, hasn't been able to prevent that jaw mobility loss, and they do have a fused jaw, I know one big concern is that if you needed to vomit or get liquid out of your mouth, that it's not there's not an easy solution. Can you talk about what some of the possible steps to kind of remedy that or to be aware of in that situation are?
Yeah, actually, it's of course horrible if you have to vomit, and I hope that you will not have to, but actually it is possible to vomit even if your teeth are completely clenched together, because at the back of your mouth, just behind your last teeth, there is a space, and also there's a connection through your mouth to your nose. So the vomit will come out, though you don't need to worry that you will suffocate or something. It can find its way out, but it's really uncomfortable. But even with completely fused jaws, you're still able to get the vomit out, and also to eat and drink. It's just way more difficult, but it's absolutely possible.
Okay. Thank you. So today I can see you rejoined us on audio. Are you able to hear me? No, I think he is still having trouble connecting with us. So I'll move on now to go back up to the nose. So there are, there were some questions about nosebleed, but there was also a question about someone who they said, I have had problems with stuffy noses and dirty noses for months without being able to find out why. We've tried antibiotic drops without effectiveness. So do Marilise or Marilyn, do you have any recommendations on, what some possible troubleshooting or solutions could be for that?
Well, we just also discussed it today. Of course, we sent the patients to him. He need to know the story very well, so we ask a lot of questions, and then normally you need to clean the nose, and you can do it with saline. So not too much saline, so a very small. And clean it. That would be the first step. And otherwise, what I hope today will come back, he is able to look endoscopically in the nose. He can do it very carefully and look what is happening. But first of all, they will start with an easy reset. Marjolein, do you want to add something?
No, actually, I also learned from today in our preparation that it's just important to clean the nose just with salty water. You can even make it at home. Just dissolve some salt in tap water, and that's not a medication, so it's not harmful, and you can use it as often as you like. And just clean your nose. I just learned today from today. It's a pity that we cannot hear him, but I think that's really good advice.
And the other piece of advice, which you spoke to, Marilise, is the nasal-oscopy. So that's one thing that Pim also sort of alluded to in your introduction, is that a lot of these issues, whether it's the nose or the swallowing, I know that swallowing is a big area of concern. We've received lots of questions about the swallowing part specifically, that those issues vary greatly from person to person. It's a very individual basis. And so it's hard to make general recommendations on treatments without identifying, as Pim said, is it the transport? Is it the swallowing mechanisms? Is it, so there's lots of different parts in play. And so doing those sort of diagnostic tests like a nasal-oscopy or the barium swallow that today spoke to are really important in being able to really accurately address the issue, because there is unfortunately, no one fits all treatments approach. So, and today, if you can hear us, we just sort of wrapped up the question about stuffy noses, and I was going to ask about nosebleeds. That was another question surrounding the nose of, is there a common theme through FOP cases that you've seen where nosebleeds are an added complication, or is that something that is not being conflicted by FOP?
I've seen it more in patients with FOP indeed, but it presents itself actually as in normal patients. So the nasal mucosa looks normal, and it is easily treated as a standard nosebleed.
Okay.
Yeah. So, shall I tell you again about the hearing loss, the prior question you had to me?
Yeah,
Okay.
Let's go back to the top, and if you can answer about bone growth in the ear or hearing loss, that'd be great.
Yeah. So hearing loss is important, especially in people with FOP. They have so much going on, and hearing loss is easily neglected. Also, we sometimes call it an invisible disability. So you don't see it, and so it is not addressed. But we see it more often in people with FOP. And there's not much published about hearing loss in people with FOP. Actually, there's one study done. And we have a variety of sorts of hearing loss. We have a hearing loss which is located in the middle ear, so the sound gets not transferred properly to the inner ear. The inner ear is where the sound is transferred into a neural signal. Well, this one study says that mostly we see the hearing loss in the middle ear. But there are only two tiny muscles in the middle ear, and you won't see them on CT. So I do not think there is actual bone formation, or to a very minimal extent. If we look in our own series, we see that this hearing loss in the middle ear is not the most prominent cause of hearing loss. The more severe hearing losses, they are actually located in the inner ear, so that a sound gets not transferred properly into a neural signal. These kinds of hearing loss, they are treated normally with hearing aids. Why we see a hearing loss there, at the moment we don't know. And you can't easily take a biopsy from the inner ear because you will lose hearing immediately. So that makes it all a bit more complicated. But it is important, especially in people with FOP, because the reduced mobility they have affects hearing even more. So head orientation is very important if you want to improve your speech intelligibility.
Great. Thank you today. I have a few questions I wanted to come back to Marileen for. Marileen, someone has asked if there has been any successful surgery to operate on a patient's jaw to unlock it. Can you
Yeah. We know exactly what to do to unlock it, because you can remove all the bone that is causing these problems. But what we see in FOP patients is that you're actually almost guaranteed to have another flare up in the area that you operated on. So if you make a scar and if you go towards the bone that needs to be removed, and if you remove it, then it's almost a guarantee that the bone will grow back. So we are definitely able to do a surgery to make the movement better, but it's not a permanent solution because the bone will grow back. So we're really hoping for future research and for medication that can really prevent the bone from going back. But right now we don't really have a surgery that will really definitely get a better movement. It's just not possible because of the FOP.
Thank you, Marileen. Marlies, I think this one maybe is best directed to you. So before we move into a lot of the questions that have come in about swallowing, this is a more general one. It's asking about scoliosis. So do you have a team? It was sort of alluding to say that, first of all, thank you for your work in this area and for the expertise that you have all pulled together around this topic and identifying that scoliosis is another very difficult condition related to FOP. And this person is wondering if you also have a team working in that who maybe we could connect with.
Thank you for the question. An important question. Well, we start with the head, of course. Well, I can show later on some slides. We have a very large team because FOP patients also is a very rare disease. It is an extreme disease, and you nearly need all the specialists there are. So yes, we have also those specialists in our team. We have an easy contact and can discuss. But as long as we don't have any medication, we can't do any surgery. And that's what Marjolein told just a minute ago. Although Marjolein is doing some surgery, but about the teeth, maybe she can speak a little bit more about it, because it's just doing a little surgery, but which is possible, takes a lot of time in FOP, and also anesthesiologists who are aware of the disease. And we have also a team of 3 anesthesiologists. So may I take this question to Marjolein? Marjolein,
Yeah. Well, what we can do, of course, is if there are any dental problems and the jaw is fused, so people have very limited movement, and a regular dentist cannot do a treatment anymore, and then sometimes it's necessary to remove a tooth or some teeth, and that's of course almost impossible if you have no movement in the jaw. So that's what Marlies is talking about. It's very time consuming. You have to do it very gently. There are certain anesthetics that we cannot, local anesthetics that we cannot use in FOP patients because we are afraid of flare-ups. So that's it's difficult, takes lots of time, but that's what we do. We do it when it's necessary. And sometimes it's such a big surgery or many teeth that need to come out, and that is not possible to do it under local anesthetics. And then we work together with a team of anesthesiologists to give a safe general anesthesia and to do the treatment in that condition.
And Dr. Zvi Grunwald also did a great presentation on anesthesia specifically yesterday. Okay. So you can access that presentation for more on that aspect of the surgery. But one more question for you, Marileen, before we move on to today. So is there a specific spot where jaw flares tend to start?
Well, actually, we did some research about that, and I think Tom Schoenmaker also did a presentation, or is still going to do a presentation.
Oh, Okay.
Yeah.
So he will cover that.
Yeah, we were looking in literature, but also in our own group at what muscles tend to be the problem in the limited movement. But it's actually in different sites that we see the bone formation.
Okay.
So there's not one place that it can start. It can start in different places. And there's actually a lot of places where the bone formation can cause these problems and can cause a limited movement. So that's the bad news. There's a lot of muscles in this area connecting the upper jaw, the lower jaw, going from the lower jaw to the other facial bones. So we have many areas that bone formation can cause a problem.
So to start off our discussion about swallowing, I wanted to, this kind of comes back to how swallowing can impact other aspects of life. You know, your ability to get nutrients in is pretty critical. So are there other future risks for people with swallowing problems? What if someone's experiencing this, maybe what should they be keeping an eye on for other issues that might arise? And then this person is also wondering if there's any medications to alleviate or to suppress the swallowing problems.
This question is directed at me, Hope?
Well, I think it could be you or Dr. Ekoff. In the patients you see who have swallowing problems, what are you looking for? I mean, are you following their nutrition? Are you concerned about weight? What other sorts of problems come along with this swallowing problem?
So I'll answer this question. So swallowing is about taking in nutrition, of course, but further it's important to have a safe swallowing movement, because you can aspirate food, and when aspirating food, you're at risk for developing a pneumonia, and that's a very important consideration in people with FOP. So what we tend to do is we tend to individualize care and develop a swallowing strategy. We do together with a radiologist. I contact my laryngologist in my department and a speech language therapist, so we can make a dynamic picture. So we may take X-rays, they swallow in barium, and we can do it in several consistencies. And during this examination, we can develop strategies how to develop a safe swallow.
And today, can you expound or share like an example? And I know we've said that these strategies or the treatments you implement vary a lot on a case-by-case basis, but can you share maybe an example of what the sort of next steps that speech language pathologist might recommend would be?
So they can, what they typically do is they give advice on how to use your tongue in a better way to have a more forceful swallowing movement. We can change consistency of food, so they develop a safer swallowing motion. But this is highly individualized, so we just see what works for a typical patient. And that is the most important thing, is that we approach this in a multidisciplinary fashion with and the laryngologist and the radiologist and the speech language therapist.
That is a great answer. Thank you so much today. Let's see here. So there was another question that had come in about examples on how to improve swallowing. You've addressed that. Someone asked a question. They said, I have had a flare up around the neck area, and weeks or months afterwards started experiencing swallowing difficulties. And they were wondering, there has been no site of extra bone growth. Is there any, can you give any ideas of what might be causing that swallow difficulties? I don't know if you could explain a little bit of the physiology behind like what with FOP, if we're not experiencing new bone growth, what is causing those swallowing issues?
A good swallowing motion has to be a powerful motion. So you have your larynx, and if you have like, of course I have not seen this typical case, but you need to, when swallowing, you raise your larynx, and by doing that, and with your tongue, you raise your larynx, and by that you open up your esophagus. And if you have a painful lesion, for example, in your neck, this can be effective. So that might be a thing, but it's very hard to tell if I can't research this patient.
Yeah. So again, I mean, we've had a lot of questions wanting very specific treatments, and as Pim shared and today has elaborated, it's really difficult to do that without seeing a patient. So, our recommendation or what we've discussed is that it's great to make sure that your local doctor is connected to the FOP, the regional or national FOP medical expert you see, and to utilize the network that they have to access insights from teams like Marilies or Dr. Ekoff and Helem Seys and Guterres' team in the Netherlands. So with that, I think we have addressed all of the questions. I know that Marilies, you had some slides you wanted to share.
Yes.
So
Yeah.
I will hand it over to you now.
Yes, thank you very much. Well, just a small summary how we work. Here you see Amsterdam, the FOP Experts Center, Rare Bone Disease Center. The following slide, please. Well, we all introduced us, so next slide. Well, here you see that we are working together with many specialists. All specialists do have their own tasks, but they are dedicated also to FOP, and we work very closely, and that is important in a center. And next slide. Okay, next slide. How do we work? Next slide. Thank you very much. Well, here you see that FOP, we are all dedicated. And what does it mean dedicated? Maybe Marjolein can also tell of today. If you see a patient, you need to take more time often. If it is a rare disease, you have to take precautions. I don't know if you want to add some information about that, Marjolein. Well, if you need time for surgery, for instance, of the teeth, then you really need to get the whole team together. The anesthesiologists, 3, they are dedicated to FOP. You need to take more time on the surgery room because you know that it's more difficult. But you are doing it, and we are very happy about that today, and all the others as well. Next slide, please. Well, why are we working so well together? Well, maybe you can comment as well, but we know each other very well. We are dedicated to FOP. We discuss it. We see the same patients together. We have the same purpose, in the best interest of the patients. We do understand how we work. We look, because we see the patients together, or I even go to the surgery when you do the surgery, Marjolein, then we know how we are working.
Yeah.
We are able to quickly switch between different tasks because it's always busy. But if we know that the FOP patient is not just asking a question, then it's really serious. And we all are really collaborators. Next slide, please. Okay. Well, here you see that we know when we need to run. Next slide. Yeah, and collaborating. Questions comes often via me or our team, direct doctor team, via FOP Amsterdam VMC.nl, but also via IFOPA, of course, via phone, via patients' organizations, outpatient clinic. And it's very important where the patient lives because the patient lives in the United States. They will go there to their doctors, of course. But in the northern of Europe, often patients come also to us. And then we have a multidisciplinary consultation and followed by an outpatient visit with one or more of our team, and then we go for further investigations. Next slide, please. And here you see that's in Dutch. That is our scheme, how we work, but the dots, the rounds, the circles show where we meet and where we discuss the patient, so that you know that we have a whole scheme for this. Next slide, please. Well, here you see that it's rather complex. There's a lot of tissue. Maybe you want to say something, Marjolein or Tadej?
Yeah, I think, well, we don't need to go into every little detail, but I think what we want to show here is that there is lots of different structures in this area. So it's a complicated area, and there are many levels where problems can arise. So like swallowing, like Tadej already said, is a very complex movement with many different structures involved. So there can be problems in different levels. So it's important to really look at the patient and do all the investigations so we know where the problem is.
Yeah. Tadej, do you want to add something?
No, I completely agree with Marjolein.
Okay, that's great. Next slide, please.
That's the kind of team we are, right? We just
When one talks, the other agrees, or we have this good discussion.
Yeah.
Well, here, differential diagnosis, there's a lot on the right side. Maybe Tadej or Marjolein, or shall I discuss it? Well, it's of course what has been said. You can look at structural, but you have also functional, the muscles, the nerves, the vessels. It can be transient, like a flu, and going away, but it can also be caused by systemic. And then we really collaborate a lot. It can be an infection, even somewhere else, or hormonal diseases. It can be due to medication side effects, energy, or environmental factors. So there's a lot, not only the structure, the tissue, but also a lot of causes that can lead to just one experience problem in FOP. Next slide, please. The collaboration. Well, I hope we showed this. Why do we have such a good collaboration? Well, it is clinically, but also we perform preclinical studies, genetic studies, observational studies, and clinical trials. And next, and I want to end with this. We have a great collaboration with many people, but a great collaboration with FOPA. That is a good input. Thank you very much. That's about Amsterdam. We are a large university, like you also can find in the United States and other countries. Next slide, please. And we do a lot of complex care. We like to search and find a new medication for complex diseases, especially. Next slide, please. Yeah, this is the end of this short slide series. I give over to Hope again.
And that is going to actually conclude our session. So I wanted to say thank you so much to Marylise for being the fearless leader to assemble your team. I know that it is not easy when we're trying to get all 4 doctors together at one time. You have incredibly busy schedules, and you made a huge attempt to make yourselves available, not only to me at the IFOPA, but to our global FOP community. So that's such a beautiful testament to how tight and really supportive the community is of one another. So thank you to Marylise and to Tadej and Marjolein for joining us today. I wanted to let everyone know that the conversation we had today about really the role of connecting to a broader multidisciplinary team, or to connecting to an FOP expert who can connect you to more experts who have experience, is a skill that I think families in our community, a lot of families really excel in, but it's not necessarily a natural thing for people. So it is something that takes practice and takes some learning to accomplish. And I wanted to do a plug for one of the sessions that's coming up. So the Connecting for Care, how to organize support in the complex world of FOP care. In this session, we're going to be talking more about how you as an individual or as a caregiver, family member, can really be empowered in the role that you have to be an active part of your healthcare team, so that you are the one who's helping to mobilize all of the different players on your team to work together and get optimal care. So I hope that you will join us at that session or one of the other 2 sessions being offered starting at 12:40 Eastern Time. There's an IFOP research and registry update, and of course the ever popular Living Well with FOP and Ability Toolbox program panel.